Ladies and gentlemen, we're going to have 3-minute pitch. 3 minutes, one idea, one opportunity to make an impact. This is where the bold ideas meet real world questions, where innovation meets investment, and where the next big healthcare solution could be waiting to be discovered. So let's get ready to hear some exciting ideas, disruptive solutions, and the future of healthcare innovation. It's a time that we are going to begin the 3-minute pitch. And let me tell all of you that we're going to have 3 minutes of session and 2 minutes of Q&A from VC panel and the audience as well. So it's the time that we are going to welcome our first startup. Please put your hands together and join me in welcoming Infograph Technologies, AI-powered enterprise applications and products. We have with us Mr. Venkataramanan, the founder of Infograph Technologies. So welcome to you, sir, and over to you. So I'm going to repeat again for all the startups who are doing the 3-minute pitch. You'll get 3 minutes for the presentation and the 2 minutes for the Q&A.
Thank you. Good evening, everyone. My name is Venkat. I'm the founder of Infograph Technologies. And primarily, we are into IT services. We do application development, and we also want to embark upon a couple of products. One is in fintech, another is the HealthTech. To begin with, we want to get into the healthcare compass. It's going to be the complete operating system for the hospitals and clinical clinics. So what is the problem that we are going to address is typically a lot of laborious manual work is being done in the hospitals, wherein a lot of operations are manual. Of course, some are digitized, but with the help of AI, we want to bring in all the fragmented processes into one platform or one single operating system, the way we call it, or one suite, wherein the time is efficiently managed. As many of the speakers have already mentioned, I think Dr. Vamsi of Apollo has mentioned, a lot of burnout happening in the hospitals because there are a lot of procedures to be done, a lot of tasks to be done, and people get burnt out. And we want to leverage AI completely in such a way that the time taken to do all this task is greatly reduced. You may ask me, what is so unique about this product? There are a lot of competitors existing in the space. The one uniqueness we want to build is completely agentic AI driven, wherein we have agents deployed across everywhere. It could be a nurse agent, it could be a staff pharmacist agent. So every role, I think one of the speakers already mentioned it, every role will have an agent going forward so that their tasks are reduced basically. And this is what I told you, this is our one vision. And our entry product is again the provider credentialing to begin with. Provider credentialing is essentially we onboard a provider, go through the credentials, management, compliances, and everything whatnot. And of course, as the next step, we will do the provider enablement, all the workforce management, clinical operations management. It's a completely a back operations team. And of course, this is the same thing. In the interest of the time, this is what I'm going to say. There's intelligent document processing, blah blah blah, whatnot, and predictive analytics coming into play. Compliance intelligence, completely agentic AI driven. And this is again a small kind of a roadmap. We already have what is going to be in phase 1, phase 2, phase 3, and phase 4. But we'll stick in different milestones as well, completely in operations of provider operations. Sorry, I'll take just a few seconds. Provider enrollment, workforce, clinicals, and whatnot, completely operations driven. Again, the unified platform and agentic AI driven. The same go-to-market strategies, blah blah blah. RA is the first platform. So what is going to be ask is basically we want to look from hospitals and clinics who wants to partner with us and develop the solution jointly. This is the primary ask for us. And as Dr. Bhaskar has mentioned, we want to love the problem than the product. Thank you.
All right. Thank you so much. Well, we're going to proceed with Q&A session. If anybody got any questions, or the VC capitalist, if you have any questions, you can shoot the questions now. We're going to have 2 minutes for that. Any questions?
Hi.
Hello.
So you spoke about an OS for clinics and hospitals and agents for multiple stakeholders there, right? So how do you control the outcome of an AI agent? Like, because I think even the panelists were mentioning it is something that is going to affect the outcome of a patient, if it's going to affect some outcome somewhere in the hospital, right? So how do you control some of those things?
Okay, so basically the outcome is going to be measured and controlled in terms of cost optimizations and time taken to to do the task or operations. Basically, get into task optimization is what I would say. So the controls could be anywhere, but the outcome measurement is how the quick turnaround we say, right? Earlier you could have taken let's say 5 hours, 4 hours to do it, and now the time taken is taken in 2 hours or 1 hour, a few minutes, right? So that's the outcome we want to measure it and track it also.
But what about accuracy, or how accurately is it delivering the any recommendation, or how has it seen the
Yeah,
data and
makes
what
sense.
is it?
Perfect question. Since it is an operations driven, so accuracy will be always 100%, right? It's not related to clinical or diagnosis or radiology, right? So that is where the accuracy has to be near 100%, and trust is also should be there, and faith is also should be there. We are carefully embarking upon only the operations to begin with, because as and when we gain more experience or expertise into this domain, healthcare domain, we want to get into the all other areas wherein little highly challenging for us.
Got it. So currently it's only operations.
Currently, it's going to be operations. It's purpose by purpose we are doing it.
All right, thank you. So thank you so much
Thank you.
once
Thank
again.
you.
Let's
Thank you.
applaud for him. Thank you, sir. Thank you so much. Up next, ladies and gentlemen, would like to welcome the next organization, Lemon Health AI. Lemon is an AI-powered preventive health companion that helps people build lasting healthy habits through personalized behavior change. And we have with us Mr. Nitin Ramamurthy, Head of Growth and Partnership. A big round of applause as we welcome him. And up next, we are going to have Zero Medic Sign. So please be ready. So kindly join us on stage. A round of applause for him. Over to you.
Hi guys, I'm Nitin Ramurthy, Head of Growth and Partnership for Lemon and AI Health Companion. So the number one thing that matters for us, the number is the number of actions that our users take, not sessions, not steps, actions. So quickly, who's building this? Dennis, a CEO who launched Google Gemini and also led the health team at Google, and a CTO who is a founding member of Google Assistant. And so while Danis was leading health at Google, like something that he learned was that uh, information was never a problem for people. So 70% of consumers want to take proactive actions about their health, but then the number one problem is not insight, but the actions on like what exactly they have to do. And this gap between knowing and what to do is where the adherence dies. And for someone with conditions like hypertension or pre-diabetes, this is a disease. So, and Lemon helps closes it. So Lemon understands a user's health profile, trackers, calendars, health records, and past activity, and then it reinforces into actionable insights and recommendations. So these recommendations might be like a 7-minute mobility sessions because you've been sitting idle for several hours, and so the system learns if the action's been done, or is it skipped, or is it like repeated. Based on that, it will see which time works for you, what difficulty works for you, and everything. So this closed loop is what is our moat. So talking about our traction, so the top 20% of our users are taking 7 healthy actions per week, and like our retention on week 9 is about 37%, which is twice the industry average, and our daily average users to monthly average users is above 35%, and out of which 30% are organic users. So I would want to also talk about our wedge, who is adults who are in between 35 to 55, who wants to take better actions at their health and who wants to change their health behavior and somebody to guide it. So they are our wedge, and our ask is $2.5 million on a runway of 18 months, and also for gaining 100,000 plus users, and also $1.2 million in ARR. Apart from that, I have 3 other asks from people here. So one is investors who value that behavior change is the key player in AI health. And number two, pilot partners, hospital owners, employers, benefit consultants who wants to, like integrate Lemon. And number three are clinicians or creators who want to like host the challenge in Lemon and get it forward. Thank you.
All right, so we are open for Q&A. Any questions? Can we pass on the mic to her?
Thanks, Nitin. One question, what is going to be the primary source of revenue for the app? Is it subscription or is it the sale of products, services on top of it?
So it's two, the business models are on two sides. One is like B2C, where we have a paid subscription, and we also have B2B2C, where we've already partnered with like companies like Meditopia. It's as a part of our B2B nutrition offering, where we sell our API. And also in B2B, we're also expanding to benefit consultants and employers who wants to get their employees get better at health. Yeah.
Thanks.
So on our closed beta, we onboarded 1,200 users, and we've just launched our product like a couple of weeks back. So it's completely US based. Like we are also like partnered with like B2B companies in India. Like uh, uh, so so our team is like split between US and India, and I'm based here. And the other thing is that 200 million people in India are having hypertension, and they have the least like outcomes of it because they're not taking right actions for their health. So for us in India, rather than B2C, B2B is like a key player for us, where we'll be partnering with employers, benefit consultants, and creators to like train our data. We have paid customers like based in India also, sir. It's registered in the US.
All right, so we are closing the session over here. Thank you so much. Thank you so much for joining us on stage and giving the inputs. Well, on that note, ladies and thank you so much. Well, on that note, we are moving on to the next one. Please put your hands together and join me in welcoming the organization named Zero Medicine, AI-powered digital chronic pain care platform, delivering specialist-led rehabilitation to help patients recover from home. And we have with us Mr. Manish, the founder. A big round of applause as we welcome him. Welcome and over to you, sir.
Yeah, hi all. My name is Manish. I'm founder, CEO of Zero Medicine. So this is an AI-powered chronic pain care platform where we focus on recovering the pain without medicine, without surgery. So let me ask you a simple question. How many of you or in your family is having neck pain, back pain, arthritis, or like some kind of pain-related issues more than 3 months? Yes, this is the thing what we are going to solve. Most of the problem is being treated with multiple medicines or just end up in the surgery part. So pain relief is not equal to recovery. And even the patient dropouts in the physiotherapy clinics also it's more because of the travel cost and the traffic which is getting the delay. Even in the chronic recovery program, the heavy cost is the hidden cost where the people are paying per sessions of money but not able to kind of travel continuously to take 10 to 15 sessions. That's why like we are Zero Medicine coming into power, like where we give doctor-led protocol for them, get 30 physios in 30 minutes and accessible for the NRI customers and the Indian customers who have issues in continuing the protocol treatments. So the market opportunity is huge. We have $3 billion plus global population who's having chronic pain. If we are able to achieve 0.5% of that market, we are able to achieve a 4 to 5 million market. So the main business model is like probably the digital recovery platform where we focus on single session and multiple sessions. And we are partnering with corporate companies, B2B, with the orthopedic doctors who can able to give them the services which their patients are needed. So the traction is this, we have accumulated around 35 lakhs of revenue and overall we have generated 1 crore of revenue. This revenue is just based on the digital sessions. Gross margin will be 50% to 70% based on the customers. Indian market, we are charging 700 to 1000 and NRI customers, we are charging $15 to $20 per session. So the go-to-market strategy is this. We are planning for performance marketing, NRI market expansion, content-led marketing. This is the people who want the services, busy professionals, global NRI population who are paying per session for like 5,000 to 7,000, which they get it for 2,000 to 3,000. So this is the revenue growth what I am planning to. So by 5 years, if we are able to achieve 1 million of the people, and if that patient is taking 1 session, we will be reaching a 100 crore company. If they are taking a 4 sessions, we will be reaching a 500 crore company. So the ask will be 1.5 crore. Yeah. So this is the team who is leading this, myself and co-founder, and we have a co-founder and advisor, and plus the doctors. Yeah, that's it. Thanks.
Thank you so much. Any questions? Yes, sir. Can we pass the mic?
Hi, am I audible? Yeah, quick question here. So you mentioned one of the things when people travel offline, right? There is a lot of travel time gets consumed. So how are you able to solve it online? Like, say, what kind of interventions are you able to build in your entire care program?
The online platform, like, most of the doctors, all the, especially we are planning like a chronic pain condition. The acute conditions always they will be taken care by like doctors. They will be taking MRI and all this thing. After 3 months, they will be having all the records will be there with them, but still the pain will not be subsided. That needs a postural correction or like a functional modification, which needs that muscles to be better. Because even the medicines and like all the supplements are just improving the muscle kind of functioning or bioavailability, but the activity needs to be done by the patient by themselves. So this helps them to do the recovery platform from their own home, and within like 4 sessions they can able to make their back pain better. Like 1 month, weekly 1 sessions, they can learn their exercise, do it in the home, and in 1 month they are much better. That's how.
Use the drop-off rate offline versus your
Yes, and we are helping the physio clinics and orthopedic clinics also to accumulate this. So if they are taking 2 to 3 sessions in the clinic, and the traveling or online part, they are not able to do it properly. So that digital part, we are able to handle it. And the corporate companies also, insurance companies, all we are helping them to reduce their surgery costs, all these things without medicine, without surgery. That's what we are doing.
Then quick question, right? So one question and a couple of suggestions. Question is, what stage is the organization right now?
So it's been like incorporated 9 months back, but we are running kind of physio clinics, workshops, and all the digital process
No,
around
the
like
question
2 years.
the question is very simple.
Yeah.
When I say what stage, I'm really asking. See, physiotherapy, delivering physiotherapy is a separate business altogether.
Yeah, we are
Right?
doing
So
that. We are doing.
if you are a physiotherapist and you are doing that as a business and or as a service, is a separate business altogether. But this as a platform, at what stage is it? Have you sold it to somebody? Do you have customers? Is
Yes,
it being
we have
implemented?
customers. We have generated
The
35
full-
lakhs
the
just
full-
from the online part.
Okay.
So
My
we have
second
an average
thing.
of 5 to 8 patients a day, and it's going on. We are focusing on content-led marketing and
Good.
B2B partnerships, so we can expand it further.
So two suggestions. One, do not claim to cure pain.
No, sure. Okay.
Right. So
Reverse it, yeah.
that may not be a right thing to put forward.
Yeah, sure.
Be a physiotherapist, be a doctor. So we really cannot cure pain. None of us.
Definitely,
Right. So
yes.
that you should not claim.
Yeah.
Second, please go back and relook at your market.
Okay.
Okay, your TAM, SAM, SOM, what you put up, please relook at it. Your projections and numbers are way too far away. Please rework on those slides.
Yeah.
See, one thing is this is a solution which is required and this is a solution which exists.
Yes.
I really could not get what is your USP
Got it.
with the existing solutions.
Got it.
So you may have to bring that out. You need not answer right now. You may have to bring that out.
The main, okay, fine.
Yeah.
All right, thank you so much. Well, ladies and gentlemen, up next, would like to welcome on stage the next organization. We have Arohan Hasprana Health Solutions Private Limited, building the world's first AI-powered multimodal sensor intelligence platform for early detection of diseases. And we have with us Mr. Ishwar Prasad M, founder. A big round of applause as we welcome him. Welcome, and over to you, sir.
Hello, everyone. Am I audible? Yeah. So we are building the world's first AI-powered multimodal sensor intelligence platform. So if you know, we are witnessing a lot of falls these days, right? People just fall because of heart attacks, massive falls, and also neuro problems, many problems, right? So we are dealing with only the cardiovascular problems, and that too, even that is a very big space. So we have narrowed down to only the coronary artery disease. Now, basically, what we are doing is, so this is the problem statement. Okay, these are all the cardiac fatalities that you see, out of which 15.8 lakhs could have been prevented. And out of all these CVD problems, CAD, coronary artery disease, accounts for the largest share. And also, we didn't want to get into the emergency space. CAD is something that builds up slowly, right? So we are building a non-invasive, unobtrusive, and continuous biosensing technology. So we'll be building technology first and deploying it in existing wearables, and then check the adoption rates, and then probably go for device development. Right, so this is we are very, this is research intensive. So we are looking for basically cardiologists turned researchers. And also we are looking at longitudinal data. So even the data is another ask along with funding. And so the go-to-market strategy is we will we in need of funds, right? What we did is basically we are also doing AI consulting in healthcare, where we also worked with ophthalmologists and cancer hospitals here. We are technology partners for them. And on the other side, wearable OEM partnerships is what we are looking at. And so the current pipeline is the collaborations hospital, and also we are looking at university interns who are helping us with the implementation of technology. And this is our business model. So we do this AI consulting, and we improve the accuracy rates through the usage of, getting more data. In the interest of time, I'll have to probably quickly move on. So these are the numbers for our market. And as I said, along with the funding, the need is cardiologists and researchers, and also the accessibility for data. Thank you.
Well, any questions? Any questions?
No.
Can we pass on the mic?
Yeah, I have the mic. So, yeah, so quickly.
We'll take the question over there from him, and then you can go ahead, sir. Yeah.
I could not capture what is the solution. What is your product?
Solution is a wearable, a technology that will be deployed on the wearables, which extracts, so it's a non-invasive, unobtrusive product that will early detect coronary
Tell me
artery
very
disease.
simply. This is a phone. This is the product. Okay. When Steve Jobs is selling it on the stage, he is selling this. Now, what is your product? Sell me that.
Our product is a technology.
No, what is the technology? I am a doctor, I want to buy this. You will have to clearly sell me. I could not capture that in your presentation, sorry. So,
Yeah, technology that early detects coronary artery disease.
how do you do that? That's what I want to know. See, I have multiple technologies which does that. What is your technology?
Our technology is we extract sweat from the wearable sensors and detect biomarkers.
So you have a sensor?
We are building it.
Okay. So that did not really come out. And again, please, sincere suggestion to all startups who are pitching, please use less of GPT and Claude. So we have seen your raw slides, whatever you put up, has a lot of value beyond this. Okay, because the numbers which are coming up, I am sure this is from GPTs and Claudes. Okay, none of this is actual TAM, SAM, SOM. If you go back and do your math, you will realize this is not right. Please use less of it, come up with real numbers, we will appreciate. If it looks dirty, no problem. You explain what you're doing, we are happy.
Thank you.
Thank you, sir.
The same question, but also along with that, where are you in the journey right now?
We are early stage. It's been 8 months since we...
In terms of product development, technology
development. Yeah, we are building the, POC for the technology development.
How long will it take to make it? What stage are you at?
We are in the initial stages, idea stage still. approximately maybe 1 year.
All right. Thank you. So thank you so much. Thank you. Well, ladies and gentlemen, quickly moving on to the next one, we have Perceptor Technologies Private Limited. Perceptor Technologies is a Bangalore-based software engineering and consulting firm that applies formal mathematics to real-world system. We design, build, and verify software whose safety and performance can be proven, not just promised. And we have with us Mr. Bharat Reddy, the founder. A big round of applause as we welcome him. Welcome to you, sir, and over to you.
Hi. So every health tech in this room is about to point an LLM to a patient database, and none of us know what's going to happen after that. So my name is Bharat Reddy. I am the founder of Perceptor Technologies, and I'm here mainly to talk about Project Acumen. So Project Acumen is a query compiler that takes HTTP queries, compiles it into database-specific pipelines. Now, okay. So why does Acumen actually matter? So it takes the reference implementation of Acumen right now is on FHIR for a health tech stack. So what it does is it takes FHIR queries, it translates them into database specific pipelines, like if it's MongoDB or SQL, whichever target database it is. And then it goes ahead and executes them and gets you back the results. And all of this happens with zero jitter and very minimal garbage collection. The reason why that matters is because of doctor dashboards, ideally speaking, because when doctors are looking at dashboards, even a 50 millisecond or a 100 millisecond delay matters a lot. So this goes ahead and eliminates that entirely. And there are three things that break at scale when you're using AI on a database. One is if the LLM hallucinates a field, or if it goes ahead and makes up something that doesn't exist, that breaks the database. Or if you have an FHIR server that's serving a lot of people, then you'll end up actually burning a lot of CPU on garbage collection and a lot of other things. So this eliminates that entirely by making sure that there's very minimal garbage collection, and also make sure that the queries are translated accurately. Now, there are the four main pillars of the technology that I'm trying to communicate right now over here is that one is that it's a compiler. It sits between the person who's making the call and the database and just translates it. And it acts as a LLM firewall, ideally. Whenever there is a query that does not have a field that's supposed to be in the database, it goes ahead and completely ignores the query. It ideally acts as a LLM hallucination firewall. And it's complete with a cryptographic layer where it goes ahead and, how should I put it? It records every single mutation to every patient record. Other than that, well, we measured some really good statistics with it. I guess I don't have time to get too much into it. A flat CPU query profile and a zero jitter clinical dashboard profile. And yeah, this is mainly what you're looking at as far as the product itself is concerned. Any questions?
In what scenarios the LLM needs to create a live query for a database? Isn't it being solved using tool calls already, where the tool is already predefined?
Yeah, the tool calls are the ones that make hallucinated queries. When your LLM goes ahead and makes a tool call, there can be a hallucinated query in there.
No. But tools are predefined. Tools do not by design. That is where it is already predefined. So the LLM is just making a tool call. It's not generating the query on the live.
Yeah, the LLM generates the query for databases. When it's trying to
shouldn't. It's what I'm saying. It shouldn't. It should never do that. And I'm just wondering, in what scenario do you need this situation where the LLM needs to decide column A versus column B versus column 3, right?
Okay.
Why can't it be just predefined in a tool call that okay, these are the query that needs to be
So you're saying like you can go ahead and design a system where the LLM's hallucinated field is blocked at some other level. Is that what you're saying?
LLM should never make a query. That's all
No,
I'm arguing.
LLMs very frequently hallucinate. They are not deterministic. They are completely probabilistic in their output. So they do hallucinate and they do create malformed queries.
And that is exactly where the tools come in. The tool is predefined. Tool is deterministic.
Yeah.
Tool. So the LLM can either decide whether I can call this tool or not to call the tool.
Correct.
But it will never decide a live query on a database. That's what I'm trying to differentiate. That okay, what is the difference between? Okay, let me put the question in another way. What is the difference between a tool call versus your solution?
Between a tool call and my solution.
Yes.
The compiler that I have is interfaced at the tool level. So if somebody has to make a call to the compiler, they'll be calling that tool call at that level.
All right.
I'll get back to you more on that if you have it.
Great. Thank you. Thank you so much. Well, on that note, ladies and gentlemen, up next, we have the startup name, Neurax. The company name, Neurax Cognitive Solutions Private Limited. Neurax is AI-enabled medtech platform delivering connected care, remote patient monitoring, and digital health solution. And we have with us Dr. Varshini, MD, the founder. A big round of applause for her. Welcome, and over to you.
A very good afternoon, everyone. I'm Dr. Varshini. I'm the founder and CEO of Neurax Cognitive Solutions. It is a AI-enabled neurotech platform. We are building a connected care pathway for the neurological conditions. So globally, we have around more than 1 billion neurological conditions existing, like stroke, dementia, Alzheimer's, and traumatic brain injuries, and many more. And what exactly happens? Today's management is extremely reactive. Once the patient gets admitted in the hospital, we focus on thrombectomy, thrombolysis, and emergency care treatment. But once the patient gets discharged from the hospital, there is no way we can track them or monitor them to assess the progress of the patient's cognitive abilities. That's what is the gap that NeuraX is actually fixing. So what is NeuraX does? So NeuraX, the patient has to wear a 4-channel electrode EEG device at home and have to take certain cognitive assessment tests back in the home. So the device will track the digital biomarkers and integrate the inputs we are getting from the SaaS platform and convert that into real inputs and helps us to project the trajectory of the patient. So we have 6 products under the NeuraX ecosystem. One is the NeuraX Recover, that is where we onboard the patient and ask them to take certain cognitive assessment tests. And NeuraGen is the model that runs the scans of CTs and MRI, which can act as a tumor prediction model. And NeuraBrand is the wearable device, which we are in talk with the OEM manufacturers for that. And NeuraConnect is the teleconsultation app. So we make sure the patient goes out of the loop and goes back to the same hospital and keep tracked. And NeuroHome is the home rehabilitation, where we connect the rehab providers back to the home so that the patient keeps the adherence towards the treatment. And NeuroCloud is the intelligence layer, where we do the multimodal fusion of it, and the model gets intelligent day by day, the data as it gets. So who do we serve for? We serve for the hospitals, stroke units, neuro rehab, memory clinics, neurologists, and the care teams and patients and families at homes. And these are the realistic numbers taken from the global disease burdens, the Lancet Neurologies, and WHO sources. And why this is the team comprises of experienced neurosurgeons, neurologists, clinicians, leads, and people with business backgrounds. And we are backed by ISB, Indian School of Business. It's a DPIT recognized startups, and IIT Madras, HTIC as well. Why now? Because the global burden of the neurological conditions are rising day by day, and we are more moving towards aging population. And also because of the advent of the brain-computer interface, the companies like Neuralink Wave started, and it is turning into a $1 billion company. So we are at the right moment exactly building at that. So we are raising 2 crore pre-seed round from taking NeuraX from the pilot to the first commercial hospital deployment. And more than the funding, we are looking for hospital collaborations and OEM manufacturers who can help us to implement this into actions. Thank you so much, and I would like to take the questions.
Good afternoon.
Good afternoon, sir.
Congratulations. Out of 8 products that you displayed.
6 products.
6, thank you. Can you please focus on one?
Sure, sir. It's a connected care pathway which
And
we are building.
second
The
is-
primary is the NeuraX Recover. So that is the primary product. Those are like the subsidiary products that which we are doing it in order to keep the patient in loop with the same hospital.
So please don't display.
Okay.
Scares the daylights out of us.
Okay, sure.
Please take it offline with me. I'll be able to help you with some
Okay,
comments.
okay, sure. Thank you so much, sir.
Yeah, very similar comment.
Okay.
Because you should always have a protagonist in your whole
Okay.
presentation. So have a central protagonist. Rest everything, if you're mentioning as a supporting actor,
Okay.
keep it as a supporting
Sure,
actor.
sir.
Because if you're looking at it as a investor, this really scares me because you don't have a focus. It is
Okay.
all over the place.
Sure.
Second question, have you sold this already, or what stage are you?
So
at
we
this?
are in the early MVP stage. We are clinically validating the product. We have the design for the NeuraX band, which is the device, which we are looking for OEM manufacturers for building it further. So the SaaS platform is in the MVP stage. So
I saw ISB, but do you also have a clinical partner who's helping you with some data to train your models, or how are you
So
building
we are, so I'm in touch with my alumni college, which is Stanley Medical College and Hospital and Madras Medical College and Hospitals. Independently, I'm trying to source data from them, get some real clinical inputs, and also taking sources from Global Disease Burden, WHO open sources, and the Lancet Neurology, which also provides open sources where we can collect the clinical inputs about it.
Okay, all the best.
Thank you so much. Thank you.
Thank you so much. Well, with that note, ladies and gentlemen, up next we have the startup name Pickle Health. Pickle Health is a predictive AI platform enabling hospitals and healthcare providers to deliver proactive, connected, and intelligent care. Please put your hands together and join me in welcoming Mr. Ramaganapati, the founder. A big round of applause. A very warm welcome to you, sir, and over to you.
Everyone, hi, my name is Ram. Sorry. Hello, hi, my name is Ram. I'm the founder of Pickle. So what we are trying to do here is to build a very predictive, intelligent platform. Obviously, it is powered by the AI. We all know, I think we have already spoken in detail in various discussion forums here. I think healthcare is pretty much fragmented. The data is much more fragmented. So the question is, how do we bring all of this together? Have a view for each of the persona who is into the ecosystem, whether it is a provider or a payer, see what they need to do, what they need to see, and how best they can use that insights and bring out some meaningful output out of them. That's more of. So I wanted to probably have a quick comparison. I think while healthcare is as large and equal to how the banking system is, at this point of time, the banking system is very well organized. We have technologies inbuilt. There are UPIs. There are various other things. What's worrying is that we don't have a similar infrastructure which is in healthcare. So our focus is to bring in that layer of infrastructure, which is intelligent, uses all the required data, provides the right insights which are required for the different personas who are working within the ecosystem. So this is the engine we are trying to build. So I think one is called as the predictive health intelligent engine, and then the second one is a CDS, which is clinical design solution. So we are trying to build a SaaS platform, which is going to have a golden processes for each of the departments and for each of the players within the ecosystem. Whether it is hospital, it will have OPD, IPD, various other ICU, CCU, it will have all of those. Each of the workflow will have agents built into that one. So it gives a wide range of technological options to the various users within the ecosystem in terms of what they need to use according to what is their requirement. This way, I think we can optimize the operations. We can also help coordinate the various departments in a right way. The data can be used in the right way to get the insights. So here are some of the the benefits in terms of one intelligent platform. So from the clinical intelligence point of view, we are going to have certain smart OPD consultations, AI-assisted consultations. Imagine a situation where a doctor knows about why the patient is entering into their cabin well before they could even see the patient. So that's one of the use case. But I think we have many other benefits which are there as part of this. I'll stop here. So at this point of time, just to summarize, I think we are in MVP stage. We have built few modules. While we have a target to have a lot more other modules, we have about 3 out of 10 modules ready. Yeah, sorry.
Yes.
I'm happy to take some questions, sorry.
Hi. Understood that it's going to be a platform, right? But what is the wedge product? Who do you sell it to in a hospital?
Well, so I think there was a deck, I couldn't show that. I think our landing point are the hospitals. So hospitals are going to be the landing point. And
but within hospital also, who would be the person who would look at this and say, wow, I need this?
So I think if I can quickly tell you, I think we are looking at two set of people. So obviously doctors are going to be the consumers of what's the output of the data, but it's going to be the front-end operators, including the nurses. I think there was one discussion where there was a detailed discussion around the nurses which happened. How could we make nurses more than a data collector and a human to a more superhuman type of person in terms of providing the right insights to them? Can they collect more data, which probably might save a doctor's this one? Can the workflow between different departments happen in a way where there is no ambiguity in terms of what the data is being asked? The exchange of information becomes seamless. So I think that's the area we are trying to address here. Yeah.
Any other question? All right. Well, thank you, sir. Thank you so much. Thank you. So up next, the next startup is Live Gracious, LVGR Wellness Private Limited. Live Gracious connects her women's symptoms, her doctors, and her daily life, so chronic hormonal conditions get continuous personalized care. And we have with us Deepika D, the founder and CEO. A big round of applause as we welcome her. Welcome to you, madam. Over to you.
Hello everyone, I am Deepika and I'm the protagonist of my own story. So I was born with an intestinal disorder, very few microvilli. Then 2 decades later got diagnosed with fibromyalgia, then endometriosis. Now a test going on for Hashimoto's. So I've been collecting these as like medals. So this is my story as well, but there are other women. There are 340 million women in India who are again going through these things. Like there are multiple specialists seeing them at different points of time. There is like their story. Their body is going through one story, but it is taken as episodes. So like what happens? Here, the main thing is hormonal balance. That is the main theme which will be there across for women health specifically. So ACOG in 2015 again defined as their menstrual cycle as the first vital sign of a woman's health, where they can they can see if there is some thyroid sensitivity, any insulin resistance is there. Anything can be figured out from here. So, and because in India, the doctors or the Indian health system, I would say, has not been looking at that as apart from the fertility thing. Like we look at our cycles only because when we want to conceive or when we are planning fertility, but apart from that, our health is not looked at that way. So there are decades added to our diagnosis, and one of the important like outcome of that is the average hysterectomy age in India is 34.9 years, whereas in other parts of the world, West, it ranges from 44 to 59 years. So there's a huge gap. So what is the solution? So here comes Live Gracious. What we are developing is one longitudinal this ecosystem for women, longitudinal data supported ecosystem, where her medical records, her lifestyle, her individual, I would say, struggles or personality, everything comes together, in which for the doctor, they get like one clinical timeline across all visits. They get to see like what all other things they are going through. They can see other doctors' diagnosis as well. And for her, it becomes one health record that follows her from her first diagnosis to her, like as long as her life goes on. So like post-menopause as well. So it is capturing data at like multiple levels, and it is connecting, and like later on, it actually makes sense of it. Where are we in terms of stage? So we are already live. So both sides, the doctor side, EHR, and the women app are live now. So the doctor we have 17 clinics who are using our application. We have 2,700 women in our community. Our app was launched, this user app was launched last week, so we got 116 women live in first go. So this is the team, the two founders and Dr. Shrestha is here. We have a very small lean team right now. The ask from this room right now is introduction to women's specialty clinics who are working in that space, clinicians who want to shape the workflow, and investors who want to back like category defining ecosystems.
Thank you so much, madam. Any questions? A quick question? Yes, sir.
Yeah, same here. Happy to help. This is a real problem, but I'm rather shocked by the number. Yeah, 30, 34, 35 is
34.9. And
my God.
there was this gentleman sitting beside me, Remedio. He was
Anand.
already telling me that my wife, my mother, they got hysterectomy at a very early age. And I was like, this is a point already in my there.
Oh, this is really scary. Me as
This
a
is
doctor
scary.
also, in the sense, is really scary. But happy to help, at least on introduction to relevant stakeholders,
Yes,
clinics
please.
or anything.
Definitely. Thanks.
Great job. Thank you. Thank you so much, Deepika. And up next, ladies and gentlemen, the next startup is Cure Alliance AI. The organization name is Cure Alliance International Private Limited. Cure Alliance AI building the AI infrastructure for global healthcare commerce, starting with pan-India and cross-border healthcare, procurement, supply chain, and sourcing. And we have with us Dr. Mohammad Faisal Hasib, the founder. A big round of applause as we welcome him. Welcome to you, sir.
Thank you, everyone. A very warm welcome to everyone here. So I am Dr. Mohammad Faisal Hasib, and I'm a dentist by training. And a risk taker, as one of the doctors said, actually an entrepreneur by choice. So like every healthcare professional, when I entered the healthcare, I believed that the treatment or the healthcare begins when the doctor meets the patient. But now it's not the same. What I believe is that the treatment or the healthcare begins with everything that makes the treatment possible. So here I introduce Cure Alliance AI. We are building the AI infrastructure for global healthcare agentic commerce because as we all know, the healthcare systems are fragmented, and artificial intelligence gives us the opportunity to unify the healthcare commerce, the procurement and supply chain. We are actually focused on the procurement and supply chain, and we believe that India has the talent, India has the engineering capability, the healthcare expertise, so we can build it not just for India but for the world. So welcome to this new era of healthcare commerce, designed in India, built for the world. So basically, the healthcare procurement and supply chain is very complex, fragmented, inefficient, and slow. Despite that, all the multiple, the stakeholders, the hospitals, manufacturers, distributors, all are working really very hard. And we face delays in procurement. We are facing higher cost. We are facing errors, and there is no visibility and transparency. So it's actually because not because of the people, but because there is no intelligence. There is no intelligence layer connecting all these multiple stakeholders. And Cure Alliance AI is that intelligence layer for healthcare commerce. So what we want to do over here is that we are already working since the last 1 year, and we are working as a healthcare procurement and supply chain partner for hospitals, clients, and we are very active in export and import. We also have a joint venture at Maldives, so we are very active in Maldives. We're even doing domestic, so but on manual and human intelligence. So basically, this Cure Alliance AI, the platform vision is to connect all the multiple ecosystems, the multiple stakeholders. So, okay, let me just go this. So we have actually the proven execution. We already have the operational intelligence. Just allow me some time, few seconds. I'll just quickly wrap this up. So we already have the operational intelligence, and that operational intelligence can become the artificial intelligence, not just through us, but we look forward to collaborate, with the multiple stakeholders, the hospitals, the technology partners, and solve this fragmented problem. And yes, basically we are a focused procurement and healthcare solution company.
Well, questions? Anybody?
What sort of gross margins do you guys operate at?
See, currently we were doing it on a manual level. So we were supplying and we were procuring the items, we were sourcing. So providing an end-to-end healthcare solution for our international clients at a net margin of maintaining, you can say, for the last 1 year, we have generated a revenue of 1.5 CR with a net margin of 30 to 35%. And in domestic, we are easily able to achieve the 10 to 15% margins.
Got it. And how would this be different than what a Medica Bazaar would be doing?
So Medica Bazaar has the product. Medica Bazaar has the product. You go to the Medica Bazaar, you want a ECG, they will give you the ECG, but they won't give you the product intelligence. Like for example, see, Medanta is buying one equipment. So Medanta Hospital is a very big hospital, but like a medium-sized hospital, just looking at Medanta and buying that product, that is not needed for them. And ultimately, they say that it's not needed for us, and it's a loss for them. And what we see is that we provide the product intelligence, we provide the supplier intelligence, we compare the different products and give them the different options. So now, and even through the agentic AI, we can make the purchasing decision. And that is actually the agentic healthcare commerce.
All right. Thank you so much. Thank you. So with that, moving on to the next startup, ladies and gentlemen, we have Oni AI. Oni is longitudinal AI women health platform with pregnancy as the primary wedge. And we have with us Mr. Shabir K, the co-founder. A big round of applause as we welcome him. Welcome to you, sir.
Thank you. Good evening. We are Oni AI. We are building longitudinal AI infrastructure for women health. Currently, we are focusing on pregnancy, but we want to expand for entire women health. So what's the problem? Currently, 98% of the pregnancies are clinically unmonitored in India. And 46% are high risk, and 50% of the time it's preterm, and 2 out of 3 newborns have growth stunting. So why this 98% matters? Because in these 280 days of pregnancy, they are getting only 8 to 10 visits with their OB-GYN. And how we are solving this problem? We are providing we are building 2 interfaces to experience. One for the mothers, which will be an AI companion, which will be replicating the senior nurse behavior. We call it Oni Didi. And it will provide their help them with solving their symptoms and complaints, help them assess the symptoms, like whether it's how it's affecting their baby. Like mostly the people Google or ChatGPT regarding their anxiety during the pregnancy. Currently, the numbers in terms of pregnancy communities like Helify and Milo is like 2.5 million daily active users are going to all these platforms just for getting some answers regarding their anxieties. So we will be providing this solution like an AI companion, which will replicate the senior nurse behavior, which will help them assess the risk. And the second thing is for the OB-GYN, they will be getting a clinical dashboard, AI dashboard. So everything will be connected through an AI unified engine. So whatever the mother records, whatever the symptoms, whatever the complaints are, everything will be directly goes back to the clinician's dashboard. And in between the consultation, whatever happened, they will get, everything will get monitored and no data will be lost. And yeah, so for the doctor's side, the value proposition is they don't have to enter anything manually. Everything will get recorded. They can continue their consultation with like keeping eye contact with their patient, and everything will get recorded and structured, and we'll flag the risk if there is any, and they will get all the structured summary, and they just need to sign off that. And the clinical pathways are programmed based on these risk flags and the current stage of the pregnancy. And yeah, okay. I'll take questions.
Well, any questions?
Yeah. Sure.
All right. Yes, ma'am.
Who will take the responsibility of recording the data? I think one key challenge is there's no single stakeholder. There's hospital staff and then there's patient. Who will make sure that the data is recorded on a real-time basis as to what patient experiences?
So whatever the data that's get recorded during the consultation will be displayed to the doctor itself. So once the consultation is over, they will get the summary with all the structured data. They just need to sign off. We will flag if there is any parameters which is like beyond the threshold. We will flag them, but they will be taking the final call whether I need to like submit this or I need to make any changes. Then I can do that, and then they can generate the summary.
And what would be the differential ROI for a hospital? A patient is already attached to the hospital.
Yes.
So how do they see the benefit of investing in the cost of the system?
Yeah. So our major approach is the payment is done by the mothers. So we will be charging 500 to 1,000 for a month as a subscription. For the hospital, we are providing it as a freemium model. So all the basic features will be provided for free, and only the voice AI layer will comes with a cost.
Well, thank you, sir. Thank you so much. Thank you once again. Let's give it up for him. So up next, the next startup name is Adya, and the company name is Mastersons India. Adya make maternal mental health care standard in Indian hospitals, spanning pre-conception to year 2, starting pregnancy to 6-week postpartum. Ladies and gentlemen, we have with us Natasha Uppal, the founder. A big round of applause as we welcome her. Welcome to you and over to you, ma'am.
So quick show of hands. How many of you were born? Okay, so that makes this everybody's problem. At least 1 in 5 of you had a mother or possibly a father who underwent perinatal mental health challenges, either anxiety, depression, or something else. I did too. I was one of the very, very fortunate people who got diagnosed, but not as soon as it could have been, and also perhaps prevented as it could have been as well. I'm Natasha, and I'm on a mission to redefine the way that we think about maternal health, to ensure that it takes into account also the couple's mental health. I've spent the past 18 years building systems for women and children across governments, multilateral organizations, and companies. And I've spent the past 3 years researching the maternal experience and the paternal experience in great detail. That has resulted in a proprietary instrument called the Matcheson's Lens. I started to see how we can't support what we don't fully understand or diagnose. And our systems today have reached a point where we do biological and physical very, very well. But every single couple entering a hospital, going through anything from preconception all the way through to year 2 and beyond, is also undergoing changes in the identity, relational, emotional, and neurological sides. This is what the obstetric journey today looks like, and of course, all of you are familiar. Even with the most excellent clinical care, we're missing out on some of the other ways in which the biological and physical outcomes are actually being impacted, and a lot of what actually takes place in the non-episodic points between, say, 6 to 8 times that you would actually meet your OBGYN. In a world with Adya, everything that the hospital is doing and doing well is layered on with perinatal preventative mental health infrastructure. So we're looking at having universal screening at three key touch points at intake trimester 3 and at 6-week check. There's a continuous signal between the touch points. So we're talking about non-episodic continuous tracking also taking place between every appointment. There's a preventative layer which every couple has access to, so that we can really closely scan whether they're at a green, amber, or a red and triage them accordingly to a counselor, a psychiatrist, or a coach. And there's a 30-second clinician read. This is based on the assumption that not all OBGYNs will have a lot of time, but some may. And if they do, then they have the information from us to be able to engage more deeply with their patient. But a 30-second read gives them a sense of where their patient is beyond just the biological and physical scans. This is what it would look like in their hands. If I could just have 30 seconds. This is what it would look like in their hands. So we're looking at mood, sleep, and voice analysis. This is the platform that the couples would have access to on a lot of preventative material. This is what the responsive care team could look like. On the one hand is what the OBGYN will see, and on the other is what our team will track consistently. 480,000 women can be, in a world with ADHYA, 480,000 women and potentially their partners who will get a perinatal mental health disorder can be prevented if we were just to include these 3 or 4 simple steps. Thank you.
Thank you. And any questions? All right.
Question I want to understand, this entire data, are you sharing with your gynec also, like neurological, emotional, and is it relevant for them to understand more about both couple?
No, so the thing that gets recorded, we give a lot of preventative support around what's happening neurologically, identity, emotional, and neurological identity, emotional, and sorry, I'm nervous. Basically, the 4 extra domains, that's what we know to provide the preventative care education support on. The gynecologist is only going to get 4 things. They're going to get the risk assessment, whether this person is green, amber, or red at every single appointment. They are going to get history. So anything that is the most important to know in terms of their trajectory toward a perinatal mental health disorder. So they'll get history, their own and their families. They will get, within the ADHYA platform, where are they? Have they been actually actively been using it? They've finished 7 out of the 8 modules. They've consistently seen a couples therapist. And the last 4th thing that they would have is a suggested acknowledgement. Given that they have less time, it would just be a suggested acknowledgement that essentially helps them tell their patient that, look, I can see that you're struggling with ABC. You can either speak with an ADHYA coach, or let's spend 10 minutes right now, 5 minutes, depending on the OBGYN. I get feedback from a lot of couples that they hate feeling like one of 200 people who are seeing the OBGYN. And I know there's constraints on all sides for why that happens, but this just allows the OBGYN to see them as beyond just the scan in front of them. So that's all the 4 things that is the most relevant for them.
How are you monetizing this? Who is paying for this?
I'm at a very early stage, so I'm doing discovery conversations right now, but the current model is that there would be a subscription, there would be an onboarding fee for the hospital, and there would be a per mother cost for the platform, which would be within what the packages already entail.
All right, thank you so much, madam. Thank you. Well, ladies and gentlemen, moving on to the next one. The startup name is SMS. The company name is Sri Sudarsanam Medical Services. SMS is building integrated healthcare access platform, combining digital healthcare, retail pharmacy, e-pharmacy, hospital partnership, patient transportation, and home care. And we have with us Dr. Arvind S., the founder. A big round of applause as we welcome him. Welcome to you, sir, and over to you.
Good evening. I'm Dr. Arvind. Most of us knows as a hospital. But when you hear a word hospital, it all means that a person going and getting treated when he is unwell. But healthcare is something beyond the walls of the hospital. So we believe that healthcare should be accessible before the illness, during the treatment, and continuous throughout his recovery. So we have formulated this healthcare ecosystem integrated. So is building India's integrated healthcare access ecosystem, combining telemedicine, e-pharmacy, retail pharmacy chain, diagnostics, home healthcare, patient seniors and transportation, hospital partnerships, coordination. I'm just rushing up. So what if you feel When someone in a family is feeling sick, what we do is we choose out for the right doctor. We choose an app for that appointment. We call up for multiple numbers for multiple solutions like diagnostics, home care, physiotherapy, medicine. So the challenges, missed appointments due to transport barriers, limited mobility for seniors, poor medication adherence, fragmented healthcare service, lack of coordinated service, so increasing chronic disease burden. Instead of seeing that healthcare as a journey, people have a stressful coordination. Yeah, okay. So there's a one solution platform, complete healthcare journey, a digital healthcare, e-pharmacy, retail pharmacy network, patient mobility, home healthcare. So at the center of this thing, we have the hospital. We've built up this ecosystem, having a hospital at the center, and supported by the digital healthcare platform or pharmacy. This is a module. I'm just rushing out because I need to show you a video. I'm sorry for this. Sorry, I couldn't get this vehicle. This vehicle has been designed. This video is not up now. The front seat of the vehicle gets converted through the wheel system. Yeah. So this is the solution we found out for the dialysis patient who find difficult to go in transportation. Because of that, they miss the dialysis sessions. I'm just rushing up for that. So we built up a healthcare ecosystem, partnering with various service providers, stating that entire patient journey should be seamless and it should give them a good care. Thank you. That's all.
Thank you. So thank you. Any questions for the final one? Any questions? All right, then we're going to conclude this. Thank you, sir. Thank you so much. So there we conclude the the startup challenge, ladies and gentlemen. Thank you so much once again for all the startups. These are the selected startups, and I hope the pitch has been really interesting for all the VCs.